Wanna pass your NCLEX? Then let's get started. Today we'll be doing a case study on therapeutic communication. Jane is a 35-year-old woman admitted to the psychiatric unit with a diagnosis of major depressive disorder. She presents with symptoms of low mood, anhedonia, feelings of worthlessness, and suicidal ideation. Jane has a history of childhood trauma and has been non-compliant with a previous outpatient treatment. She appears withdrawn and hesitant to engage in conversation with the nursing staff. Here are the nursing notes. Time 0800. The subjective patient reports feelings empty and hopeless, states, I just don't see the point of anything anymore. Objective patient is sitting on the edge of the bed, avoiding eye contact, appears tearful, limited response to questions, appetite poor, refuses breakfast. Assessment patient exhibits signs consistent with moderate depression. Risk of self harm is elevated, requires close observation and frequent monitoring. Plan, implement suicide precautions, encourage expression of feelings through therapeutic communication techniques, administer prescribed antidepressant medication as ordered. Question 1. Which statement by the nurse demonstrates therapeutic communication with the patient? You should be grateful for what you have. There are people worse off than you. I can see that you are feeling sad. Would you like to talk about what's been on your mind? You need to pull yourself together and stop thinking negatively. I know exactly how you feel. I've been through tough times too. Pause the video and select your answer. Now, with this case study, we have 10 questions. The correct answer is B. I can see that you're feeling sad. Would you like to talk about what's been on your mind? This option demonstrates empathy, acknowledgement of the patient's emotions, and an invitation for the patient to express their feelings, making it the correct therapeutic communication response. Question 2. Which therapeutic communication technique is the nurse employing by saying, Tell me more about what's been troubling you? Offering self, reflecting, open ended questions, providing information. Pause the video and select your answer. The correct answer is C, open ended questioning. This option encourages the patient to share their thoughts and feelings freely, allowing for a more in depth exploration of their concerns, making it the correct therapeutic communication technique. Question 3. Which response by the nurse demonstrates empathetic communication? I understand how difficult this must be for you. You shouldn't feel that way, things will get better. Why do you always focus on the negative? Just try to think positively and everything will be fine. Pause the video and select your answer. The correct answer is A. I understand how difficult this must be for you. This option acknowledges the patient's feelings with empathy and validates their experience, making it correct empathetic communication response. Question 4. Which statement by the nurse demonstrates therapeutic communication while establishing boundaries? I can't help you if you continue to refuse to eat. You're always so difficult to deal with. Let's focus on finding solutions together. Stop being so negative all the time. Pause the video and select your answer. The correct answer is C. Let's focus on finding solutions together. This option acknowledges the patient's difficulty while redirecting the conversation towards problem solving in a collaborative manner, making it the correct communication response with boundary setting. Question 5. We're halfway there, guys. Let's do this. Which therapeutic communication technique is the nurse using when stating, It seems like you're feeling overwhelmed? Is that accurate? Offering self, reflecting, summarizing, seeking clarification. Pause the video and select your answer. The correct answer is D, seeking clarification. This option involves asking the patient to confirm or clarify the nurse's understanding of their feelings, promoting effective communication and understanding, making it the correct communication technique. Question 6. Which response by the nurse demonstrates active listening and validation? You shouldn't feel that way. There's nothing to be upset about. I hear what you're saying, but you need to look on the bright side. It sounds like you're feeling really frustrated right now. Stop dwelling on the negative, it's not helping. Pause the video and select your answer. The correct answer is C. It sounds like you're feeling really frustrated right now. This option reflects active listening by summarizing the patient's feelings and validating their experience, making it the correct response that demonstrates active listening and validation. Question 7. Which therapeutic communication technique is the nurse using when stating, "Can you tell me more about what you're experiencing right now?" Offering self, reflecting, clarifying, providing information. Pause the video and select your answer. The correct answer is C, clarifying. This option involves seeking additional information or clarification to ensure understanding, making it the correct communication technique. Question 8. Which response by the nurse demonstrates therapeutic communication while providing validation? "You shouldn't feel that way. Things will improve soon. I can see why you feel upset given your situation. Stop dwelling on the negative. Focus on the positive instead. There's no need to be sad. Everything will work out in the end." Pause the video and select your answer. The correct answer is B. "I can see why you might feel upset given your situation." This option acknowledges the patient's emotions and validates their feelings by recognizing the reason behind them, making it the correct communication response with validation. Question 9. Which therapeutic communication technique is the nurse using when stating, "Can you tell me more about what you're experiencing right now?" Reflecting, offering self, clarifying, encouraging elaboration. Pause the video and select your answer. The correct answer is D, encouraging elaboration. This option encourages the patient to provide more details or expand on their current experience, promoting further discussion and exploration of their thoughts and feelings, making it the correct communication technique. Question 10. Way to go, guys! Which statement by the nurse demonstrates therapeutic communication while providing empathy? "You always so negative, it's exhausting. I'm sorry you're feeling this way, it must be very difficult for you. Why don't you just try to cheer up and think positively? You need to stop focusing on the bad things and start appreciating what you have." Pause the video and select your answer. The correct answer is B. "I'm sorry you're feeling this way. It must be very difficult for you." This option demonstrates empathy by acknowledging the patient's feelings and expressing understanding, making it the correct therapeutic communication response with empathy. Click that subscribe button and comment below and let us know how you did. Join us every Wednesday.